A roundtable discussion this morning involving Congressman Tim Kennedy and leaders of various veterans organizations from the area, covering a number of topics, according to the representative's office, ranging from health care delays at the VA, potential staffing cuts at the agency, and changes in housing programs for vets.
As the Trump and Musk administration continue to cut services and jobs by the tens of thousands across the country, including 83,000 jobs at the VA, putting our veterans' health care at risk.
We would not do something that would put patients at risk. With the staffing levels that we have, look at the nonsense we saw at the Buffalo VA last year, with the highest staffing levels ever. An entire department just didn't do their job.
Langworthy was speaking of what happened in the summer of 2024 as two top administrators at the Buffalo VA hospital were removed. Kennedy, who is a member of the Veterans Affairs House Committee, has pushed since last year to replace the aging Buffalo VA hospital, as he called it, a crumbling facility. And today he told reporters,
with a new administration that is cutting across the board veterans services and, quite frankly, freezing funding across the board that had already been allocated to many different projects across America, certainly that is a setback in the moment. We're in this for the long haul.
But after speaking of setbacks on the long haul, the former Biden administration's VA Undersecretary for Health said this after a personal visit to Buffalo's hospital last year.
We have a list that I know you're aware of, Congressman. It's called our SKIP list, that has the priorities that have been in place for many years in terms of facilities on the queue. There are at least 7 full VA medical centers that would be ahead of Buffalo. And to be able to get to a new medical center, we'd need appropriations for major construction that exceed $20 billion.
Now, last year, under the Biden administration and previous Congress, there was a plan to lease space from UB for VA Health, but also the Veterans Administration reporting a surprising $15 billion deficit while trying to hire more and expand care for the PACT Act last year to treat veterans exposed to toxic burn pits and other chemical agents. On your side, Ron Plants, Channel 2 News.